Dear active members of the PCR community, good morning. We're very pleased that you could join us here in Paris for this 25th edition of EuroPCR. Welcome home. EuroPCR is a unique reunion of the worldwide interventional community. We gather during these 4 days from all over the world to achieve one noble, common, major objective. At the end of this course, I want to be able to provide superior and personalized care to each of my patients.
Our profession is a unique one. As interventional cardiologists, we need to integrate both scientific evidence and practical skills. We need to deliver to our patient the optimal blend of accurate diagnosis and effective therapy. As a community, we lean on our peers, mentors, role models to learn and improve knowledge and skill. Through sharing, we benefit from one another's advice and experience as we develop and refine our skills.
On this lifetime journey, PCR wants to stand by your side, right in the cath lab, where the action is taking place. A massive array of information circulates back and forth during and between our courses, constantly enriched by the community. Therefore, your contributions are our bigger asset. Everything the community brings to us, we wish to share with you, make it easily available to you when you need it. So to this end, PCR is developing a number of tools and resources that are intended to help practitioners to craft customized solutions for the treatment of their patients. So bear with us for the next 9 minutes. We have something important to share with you. These PCR tools and resources will become your companions in daily practice, and we will now shortly introduce these tools and resources to you.
The first one is Pcr Pipeline. We are launching today this new website, Pcr Pipeline. What is it exactly? Suppose that you intend to perform renal artery denervation, renal artery stenting, rotablation of calcified coronary artery lesion, or that your next case in your cath lab will be a complex bifurcation lesion involving 2 stents. You select stent, and on your Pcr Pipeline tool, you will find an answer to all your questions you may have related to the various technologies. If you wonder about stride thickness, crimping profile, cell size for side branch access with a different type of stents, that information will be readily available. In addition, on this website you will find links to preclinical and clinical data, old publication, even in journals such as biomaterials that we do not necessarily have at hand.
Another novel and unique initiative that we are launching today is called Pcr Edu Online. Let's watch together a short video sequence with Jean Marco and Ibrahim Al-Rajdan.
But now we are speaking about the future, and the new initiative is Education Online. So can you explain to me what is your vision, and to share with our peer, what is your vision on web education?
Well, thank you very much, John. I think you clearly reiterate the spirit that you bring to the PCR education, which is respect for the peers, it's peer-to-peer, practicality, and being related to the daily practice. However, in my observation, that these things were concentrated around the conferences, around the congresses and the seminars we do, and we lose the audience, we lose the connection to the majority of the community in between these congresses. So we were in search for a tool for an educational tool that keeps us at all times in communication with our peers. So we continuously, throughout the year, elevate our education.
So Pcr Edu Online is a new educational tool specifically designed for distant learning among interventional peers. Suppose you want to start a radial program. What prevents you from becoming a radialist? What are the key learnings to keep in mind at each procedural step? The modular design of this distance learning tool allows you to pick the question of interest to you, listen to experienced operators, ask questions, exchange your reaction with peers, and all that information will be available by watching short educational vignettes like this one we've just seen.
The next tool is Pcr Online, led by TrueLab expert. Pcr Online is a daily source of scientific information for the world cardiovascular community, a trusted reference and forum of exchange. Discover authoritative and robust educational content, drawing on PCR courses, delivered in an innovative and dynamic format to thousands of online members. Follow this course, the real case experience, step by step, take part in the discussion of each stage in the process, read a selection of articles from publication commented by young practitioners. Both the key topics section on bifurcation, bioresorbable scaffolds, TAVI, structural heart disease, drug-eluting stent, and much more. Videos of courses are available. You could find sessions, clinical case, interviews. The PCR course slides are also available. You could find news and really much more. Let me give them some key figures. It is 50,000 member worldwide community, compiling 15,000 lectures, 1,000 videos, and 1,200 cases that you could find on this website.
Your intervention, you know about the journal. It is the subscription-based multimedia reference journal in interventional cardiology. Its aim is to create a community of high-quality research and education in the field of percutaneous and surgical cardiovascular interventions. While our foundation at Your Intervention is clearly European, the outlook is international, focusing on the cutting-edge future of the specialty. It is the official publication of EuroPCR and EuroPCI. It is indexed in PubMed and Medline, impact factor 3.17. To date, Your Intervention Journal has more than 10,400 subscribers. This is, for instance, one article that we selected to show the multimedia component. It is about the first-in-man delivery of a new TAVI valve by Dr. Nico Piazza, and you can find in the journal the clip that shows exactly the delivery process and how to perform it. Pcr Trials. Of course, you know about the PCR book. It's a yearly edition that has all the relevant trials in it. Now, suppose that you're in the cath lab in the middle of a primary PCI procedure, culprit is treated, patient has multivessel disease. And Jean is discussing with his colleague, should we do the other non-culprit vessels as well? And you're arguing about the results of the latest trial, PRAMI. You seem to disagree whether or not this trial showed reduction in the primary endpoint. No problem. You pull Pcr Trials, on the spot, you go to PRAMI, and there's the answer.
PCR EuroPCR textbook. Of course, you know already about the EuroPCR textbook. There are 4 volumes dedicated to diagnostic, coronary intervention, structural heart disease, peripheral intervention, and perspectives. The digital version makes this textbook an evolving encyclopedia of interventional wisdom to be shared, questioned, criticized, and improved by you, reader. The book is accredited by 40 semi-credits, and we are just publishing The online updates, no less than 25 chapters. Next will be OCT Atlas. Have you seen in this room OCT Atlas? Even if you are not user, and perhaps even more so if you are not expert in OCT, this resource can help you to understand complex angiographic images. And look, for instance, this thrombotic occlusion of the right coronary artery. And you will see immediately the added value of OCT imaging showing thrombosis, plaque rupture, and TICFA. So the value of OCT is obvious. What you will find, all these tools, all the presentation of educational tools in our stand. Today, we will invite you to discover all these tools in the PCR booth. In the exhibition, level 1, you will find digital screens, iPads, everything available for you, and make them yours.
All of this essential and relevant information for our practice is generated through your contributions during all PCR courses. I have to say that today is a special moment. PCR is proud to make this knowledge and this collective intelligence available to the interventional community in the form of well-organized, structured, and readily accessible tools and resources. That's the benefit of being part of the PCR community, but remember, the objective is to provide superior and personal care to each of our individual patients. So thank you very much for your attention.